to my YouTube channel. My name is Mafe Iyinoluwa. Today I'm going to be talking about HIV/AIDS. I know everybody knows about HIV and because it is a common topic, but there are some people that doesn't understand it fully well. Well, today I'm going to be talking about HIV/AIDS. HIV, which simply means human immune deficiency virus, can be defined as a type of very small virus that enters the human body through blood or sexual activities that destroys the human immune system and leaves the body defenseless to diseases. And if not detected very early, it can lead to AIDS, which means acquired immune deficiency syndrome. And it may be uncurable and can lead to a big problem to individuals. There's the modes or ways through which people contact HIV/AIDS. So there are some ways that people contact HIV/AIDS without knowing. People contact HIV through unprotected sex. This is a common way of contacting HIV. If a person who is negative of the sex, negative of HIV, engages in an unprotected sex with a positive person, it is likely the person contacts HIV/AIDS. Blood transfusion. A person can contact HIV if he or she is transferred with an unscreened blood. He or she can contact HIV/AIDS through contaminated or infected sharp objects. Some people may just think if you see anything on the floor, you pick it, you use it. Sharp objects especially leads to HIV because HIV deals with blood that enters the body and leaves the body defenseless to diseases and destroys the immune system in the body. So the reason how people get contacted by HIV is when they use a contaminated or infected sharp object like razor blades, syringe, unscreened syringe, if it's not tested, blades, syringes, razor blades, needles used in fixing fixing weave-ons, hair in salons, nail, pins, syringe, and all sort of that. They can lead to HIV/AIDS if not avoided. If you not avoid it, it can lead to HIV/AIDS. So now I'm going to talk about symptoms of HIV/AIDS. Persistent headaches and eye fever, sore throat, swollen glands, consistent tiredness, conspicuous white spots in the mouth and throat regions. Those are the symptoms, or those are the ways to know you have HIV. So now we are going to the prevention of HIV. For the use of contaminated or sharp objects, you can try to just have your own thing, have your own needles, have your own razor blades, have your own barbing cords, have your own everything that that is sharp objects. Always try to have yours with you, because if caught with a person positive of HIV and you also use that same sharp object, and we all know HIV deals with blood, it's likely you can contact it. So if you don't want to contact it, try to have your own separate thing yourself. When you are going to a salon, always make sure you have your own cotton comb, you have your own barbing thing, you have your own everything, just to avoid contacting HIV. For the blood transfusion, always make sure that the blood being passed through you, or if any blood wants to be transferred to any of your family that you love, that you care for, always try to advise the doctor to screen it, to test the blood if it's okay to use it and it's okay to be transferred. And for the unprotected sex, condom is the best. I think so. Yes, condom is the best, because according to the prevention, we have ABCTE. Condom is a way of, it's used for people that are so used to unprotected sex, but you must also note this, that condom doesn't lead to safety of contacting HIV, but it's just for people that are too, I don't know how to put it, like they are too much in unprotected sex. They are just for them to make it a little bit not too contacted, just a little bit, but it's better you use it because it is the best. Then being faithful, you have to be faithful to, yeah, is for married people. When you have a married partner, always make sure you are faithful to he or she, and always make sure you abstain from unprotected sex, and don't just try to be with you and your married partner, because that's the best, because it helps a lot. Because when you go out and have an unprotected sex with a lot of people, it can lead to contacting HIV. And the key there is testing. Whenever you've noticed all the symptoms of HIV, you'll see that you're having headaches, fever, sore throats, swollen glands. Always try to go for checkup, and always try to do testing, especially for married people. When you just get married, your partner, you don't know about them, just some of you should just try to go and make a test at the hospital to know that you both are okay, so that it will lead to contacting HIV/AIDS. And education. Always try to create awareness to people or young people that doesn't know about HIV. Like what I'm doing now, you guys should also try to create awareness to people about the danger of the virus and about the danger of everything. Well, that's all for today, guys. And if you don't understand anything, or you need a question, or you don't understand, or there are some things that you don't understand in what I've said, you can comment below, and I have a question for you guys too, and you can answer by commenting. Here is the question: how will you know if a person is contacted with HIV? If the person is wearing a cloth of long sleeve with a mask and hat, all the whole body is covered, how will you know if the person has HIV or not? My answer is for my next video, and don't forget to like, comment your answer, share, and subscribe on this video. Thank you. Bye.